Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Dermoepidermal junction or the basement membrane zone. So this is nothing but the junction between the epidermis and the dermis. So it is between the epidermis and that of the dermis. So this is known as the basement membrane zone or the dermoepidermal junction, and it contains a number of extracellular macromolecules. So it has extracellular macromolecules. So as many of these components, they are glycoproteins. Many of these components, they are glycoproteins. The BMZ, it can be recognized histologically by staining with the PAS stain. So they are recognized histologically. Histopathologically, it can be recognized by staining with the PAS stain. Next, moving on the US examination, that is ultrastructural examination. So based on this, it is by the electron microscopy, EM, that is electron microscopy. It shows two different layers with different optical densities. So 1 and 2. So the first one being the lamina lucida and the next one being the lamina densa. So what is this lucida? So lucida is nothing but the upper less electron dense layer. So it is the upper and less electron dense. It is an upper and the less electron dense region, and the lamina densa being the lower, and it is a more electron dense layer. So densa is the electron being dense. So DE. So it is a densa is the electron being dense. So there is more electron dense. So this zone is composed of three components. So components, there are three. First one being the hemidesmosome. Next one being the anchoring filaments, and third one being the anchoring fibrils. Now moving on, let's look at the hemidesmosomes. So under the hemidesmosome, they are nothing but the multi-protein complexes. It is a multi-protein complex. It is a multi-protein complexes. They facilitate the stable adhesion. So it facilitates the stable adhesion. Facilitates the stable adhesion of the basal epithelial cells to the underlying basement membrane of the basal epithelial cells to the basement membrane. Next, there is intermittent keratin filaments. So the intermittent keratin filaments, there is K5 and K14. So this K5 and 14, they are present within the basal keratinocytes and attached to the hemidesmosomes. Attached to to the hemidesmosome. So they are present within the basal keratinocytes. So within basal keratinocytes, and it attaches to the hemidesmosomes at the base of the cell. So this is at base of cell. Next, moving on, there is a major hemidesmosome. The major hemidesmosome protein it is nothing but the bullous pemphigoid antigen. So the major hemidesmal protein is the bullous pemphigoid lesion. So it's a bullous pemphigoid antigen. So it is 1. So major hemidesmosome protein is bullous pemphigoid antigen. So what is it called? It is known as the BPAG1 and also the BP230. So these are the two major hemidesmosome protein, and this attaches to the transmembrane component protein. So it attaches to a transmembrane component protein. So this is nothing but the BPAG2. So bullous pemphigoid antigen 1, it attaches to the transmembrane component protein BPAG2 below. So the other hemidesmosome protein is the plectin. Another important one is the plectin. So this plectin is attached to the transmembrane component protein. So it is attached to a transmembrane component protein, TMC protein, and this is known as the alpha 6 beta 4 integrin below. It is known as alpha 6 beta 4 integrin below. Next we move on to the anchoring filaments. So under the anchoring filaments, it is nothing but the lamina lucida or the lamina densa, including the lamina lucida as well as the densa. So this anchoring filaments form the lamina lucida layer. It forms the lamina lucida layer, and the anchoring filaments, it contains of the laminin 5 and the 332 proteins. So we have the anchoring filaments. The anchoring filaments, it contains the laminin 5 and laminin 332 protein. So this is lamina 5 and the 332 protein. So what this does is it connects the BPAG2 and the alpha 6 beta 4 integrin. So what this does is it connects. So it connects the BPAG. So we have BPAG2 and the alpha 6 beta 4. So what this does is it connects the BPAG2 to the alpha 6 beta 4 integrin, and this is above to the lamina densa below. So it attaches this to the lamina densa which is below. Next, moving on to the lamina densa, it contains So, this lamina densa, it contains the type 4 collagen and also the other proteins like the nidogen. Then lastly, moving on to the anchor fibrils. Anchor fibrils. The anchor fibrils, they are ultrastructurally, they are U-shaped. So, it is ultrastructurally, they are nothing but U-shaped structures. They attach the lamina densa above to the underlying connective tissue below to the dermis. So, it connects. So, what it does is it connects the lamina densa. So, it connects the lamina densa above to the underlying connective tissue. So, the underlying connecting tissue or the connective tissue below in the dermis. So, the ultrastructurally the U-shaped structures that attach the lamina densa above to the underlying connective tissue below in the dermis. There are also some blistering disorders in the DEJ, BEJ. It arises to the defects in the antibodies. So, there are some blistering disorders in the dermoepidermal junction as well as the basement membrane zone. So, here it due to the defect of the antibodies against any of the above mentioned proteins. Then moving on. So, to recap, we have seen the hemidesmosome, next the anchoring filaments, and lastly we saw the anchoring fibrils. Channel.